Here we are. Hey, how are you all doing today? Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa with PAR5 Physical Therapy, and I partnered with them to bring you today's easy and educational workday session. So today's session is all about fall prep, backpacks, sports, and back pain in youth athletes. So as the school year begins, many of these young athletes return to sports while also carrying heavy backpacks. So this session is going to be focused on protecting young spines with smart strategies from a physical therapist. So what we're going to learn is how backpacks and poor posture affect spine development, injury prevention for fall sports, movement screens that every youth athlete should be able to go through, some recovery and mobility drills to build resistance, and some tips for parents to recognize early signs of overuse and stress. A little bit about me. I received my doctorate from Mercer University, and in 2010, I also have an exercise physiology degree from Rutgers University, and I've been in the PT field for over 25 years. I'm a certified orthopedic clinical specialist, certified dry needling specialist, certified golf fitness instructor and golf medical professional, and a level 1 CrossFit coach. So enough about me. Let's get into our slides here. Let me pull them up. Boom, right there we go. So all about fall prep, backpack sports and back pain in youth athletes. All right. So just because, again, I am a medical professional, I got to put this up. This is an important note that if you're dealing with something specific, an injury or an ache or whatever, make sure that you get that thoroughly assessed by a medical professional. Because the stuff that we're going to be talking about today is broad, is information that's helpful, but aimed at a broad population, a broad audience. So for specific issues, want to make sure that you get yours all addressed. All right. So if you've been to any of my classes before, you know that the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So if we start at the foot is supposed to be a stable segment, right? And then the ankle is hip is supposed to be mobile. Then the lower back is supposed to be stable. Then the thoracic spine, the T-spine is supposed to be mobile, and so on and so forth. So when we're looking and assessing somebody, we want to make sure that all of these segments do what they're supposed to do, because if not, there gets to be some compensation where one body part that's supposed to be mobile or supposed to be stable reverses its role, and then we get pain or injury or some type of ache or pain. All right. So some backpack tips. All right, let's talk about them. Bags should have 2 wide padded shoulder straps, and should be an appropriate size for somebody's body, for these kids' bodies. So one, they should never weigh more than 10 to 15% of the individual's body's weight. And the heaviest items should be placed closest to the back. So remember that bigger isn't always better. When there's space to fill in a big backpack, you're likely to carry more. So it's important overall to act swiftly when a child experiences pain or discomfort, so to prevent injuries and long-term musculoskeletal problems. If an individual or child is experiencing pain or discomfort, they should schedule an appointment and see a therapist, because we want to make sure that the pack is fit for them correctly. So you want to wear the pack correctly. One, you should never wear the backpacks slinging over one shoulder. I remember in the 80s when I was in school, we would do that all the time. We get that, messenger bag or the backpack, just one shoulder, because you want to look cool. But the strap should be properly placed on the shoulders according to the design of the backpack. So we want both shoulders on so that the weight is evenly distributed and supported by the body. Some heavy backpacks, like hiking backpacks, have a waist strap. So if you're going for long hauls and you have a lot of weight, the waist strap, which puts the pressure or weight on the pelvis and the hips, is a game changer. That really reduces the shoulder and back pain. All right. You also want to pick the right pack. Like I said before, you want to pick one that matches the size and age of the child, because this is essential so that you ensure that it can bear the load, the child can bear the load, and everything that they'll be needing to carry. Another thing you want to remember is that you want to pack for the day. Any unnecessary weight should be removed at the start of each day so that the child is carrying only what they need for the day. So we lighten the load. I know that my child is notorious for packing things in that they either found at school or their friend gave them. And you look at their backpack and say, hey, you got to empty your backpack. But when you get home, there's all these stuff. There's like rocks, there's like toys, there's little action figures. Who knows what's in there? So make sure that you go in there. And when it has all of these features of these backpacks, you want to make sure that, again, like I said before, where weight is away from the spine, the relatively more stress is going to place on the shoulders and the body. So closer, heavy. All right. And you want to check in through the ear. Looks like my thing. All right, technical difficulties. I don't know what happened, but the Zoom started over again. So now we've got a little bit of a break. Hopefully everybody can make them back in here. Let me check my chat, check my participant list. All right, I think we are back up. Okay, so just starting where we left off, everybody's here. Cool. All right, so starting where we left off, the major thing that we want to look for, the next slide is here, checking. I'm getting all these alerts on my laptop here. We want to check in through the ear. All right, checking in through the ear so that you address any worn or broken straps right away before that they can contribute or create undue strain over time. So this is what we're trying to avoid really in young athletes and young students, is that we want to avoid developing a functional or structural scoliosis. Okay, so what we're looking at here is how shoulders can be even, and we don't want to create some curvature, some lateral curvature. All right, so if you're looking at your child from the back, we would like it to look like this, so there's no space between the arms and there's no curvature, there's no lateral curvature of your spine. So worst case scenario, we run into the scoliosis. Whereas a normal spine may look totally straight, the scoliosis, the problem is that the shoulder blades become uneven, the shoulder heights become uneven, and also this goes down into your lower back and into the hips and the pelvis. So you want to watch that for that as well. The next thing is, the injury is prevention. We want to, that starts with a movement assessment, right? We want to be able to assess somebody to get a movement checkup. It's sort of like if you go to your physician, you go to your doctor, you get an annual checkup, you go to your dentist every 6 months, get your teeth cleaned, you get your blood pressure checked, you get your heart rate checked. We all have all these vital signs that if they're outside of normal limits, then we have to kind of address those before they get bad. The same thing happens with movement. There are movement vital signs that we want to make sure that everyone is able to do, because physiologically, these are the norms. And when you're outside of these norms, that's what sets you up for issues. So here, this is a quick little slide here about the functional movement assessment. We look at these vital signs starting from the head, the shoulders, and we look at the spine, we look at the rest of the body, and we look at how you squat, looking at ankles and knee range of motion. So these are the things that I take a lot of my athletes and clients through to determine what their capacity of movement is and their tolerance to stress. Because if you can't perform these functional movements here within normal limits, then when we start to add load, i.e. like a backpack or some type of outside stretch, like a stress like lifting or carrying an object, or some type of sport where we're talking about velocity, speed, fatigue, other factors like other players, we want to be able to be as resilient and durable as possible. So this is where it all starts. Simple thing that you could look for is multi-segment flexion, right? So what you do is you have your child stand with feet together. All right, they're going to stand with their feet together. They're going to keep their knees straight and they're going to bend forward. Now, keeping the knees straight, what we're looking for is the ability to touch the toes, all right, with the knees straight and a uniform curvature of your spine. Sometimes people will go that have really flexible hamstrings. They'll be able to go down all the way, and I see this a lot with our gymnasts, is that their spine stays straight, but because their hips and their hamstrings are so loose, they're able to touch their toes, but their spine doesn't bend in this direction, flexion. So we want to watch out for those and watch out for some compensation. By the way, in this position, you can also check for any developing scoliosis by looking from the back. So you can see here that if you're looking from their back and they're bending forward, the spine and the ribs should be even and flat. When there is like a little hump going on where one side is higher than the other, or there's a bump, the hump in the spine can indicate a deformity that's caused by the scoliosis, so that curvature. All right. There are two types of scoliosis. There's a structural scoliosis that we're always looking for as the spine develops, and then a functional scoliosis that because of our positions that we put our body in throughout the day, that we develop some type of lateral shift or curvature because one side is short or tight and one side is long and loose and weak. So that develops over time, and you can also do exercises to kind of reduce that. So typically when we're looking at this, we're looking at, what is it a degree? How many degrees of the curvature? Usually anything below 12 to 15, they usually leave alone and they monitor. Anything higher than that, you might have to address with either bracing or surgery. All right. The other test is multi-segment extension. Again, you have your child stand with feet together. The knees are straight. The arms go over the head. The bicep and the arm should be by the ear, and the arm should be able to go totally straight. And then the hips go forward while the shoulders go back. You can see the two lines over here. One, the front line is the pelvis line. The front part of the pelvis should extend past where the toes are, and the back part of the shoulders should extend past where the heels are. So that would be full multi-segment extension. That person is moving within normal limits. So you're always looking for that. And then if they are outside of those normal limits with those two movements, that flexion and extension, we have to unpack and see where does that limitation come from? Either from the knees, ankles, calves, back, hips, shoulders. So we have to kind of dive in a little bit deeper. But these are the top tier 30,000 foot view tests. All right. So a couple injury red flags. One of the big things that happens with child sports is concussions. So these are some things to keep in mind, whether a person is showing up with double vision, neck pain, tenderness, there's a loss of consciousness or some type of seizure, convulsing, some radiating symptoms like nerves, tingling, weakness that happens in more than one limb. If it happens in one limb, there's probably just one nerve root over there. But if it happens in both, that kind of is a red flag for a spinal compression or something. And then also have mental status, deteriorating mental status, vomiting, and severe headaches. So these are some things that you have to kind of look out for. And if they come up, then you might want to suspect that there might be a concussion. And there is a certain protocol for recovering from concussions, which can be very difficult because they're not visible in terms of the injury. It's really an injury to your brain, and you have to kind of let your brain recover. And then if we look at this, these are some red flags to rule out fractures, right? So somebody fractures or they're kind of having trauma during their sport. If there's swelling, edema, sudden pain, tenderness, there's an obvious bone deformity, there's redness, and also the inability to bear weight. So some of these things you could think about, all right, they may rule in a possible fracture when all of these things are present, all right? And then we have normal types of symptoms that might happen because we're getting back into fall sports and going into activities that we haven't done through the summer months or through the spring months. And, a dull achy soreness that's more diffuse. It's not like a pinpoint oh, it hurts right here. It's kind of all over. but they still have full range of motion, and they are still able to weight bear fully, and then these symptoms gradually reduce over 48 hours. Now, with muscular soreness, it could also be delayed, where after that first practice or that first training session, they're fine for the first day, but 24 hours to 48 hours after, they start to develop this soreness. And again, it's sort of like a yellow light. We proceed with caution during our next training cycle so that we don't exceed our tissue's tolerance or our body's tolerance to that stress. So you have to kind of progress slowly and kind of use like that red light, yellow light, green light analogy that I've spoke about in other classes, so that you're training and programming the recovery and exercise sessions properly. All right. So a couple of key things to think about, key exercises. I love taking athletes through this. Anybody that's kind of going back into sports, is we want to be able to master these movements, master a hip hinge, master a proper squat, and also look at how do we strengthen the posterior chain. And the posterior chain is this fascial chain of muscle that goes from the base of your head all the way down to your heels. So that line of muscle really helps to prevent injury, works on deceleration, which is typically where people get injured when they're accelerating really fast and they have the inability to decelerate. And then also where it helps to works on posture. So we want to be able to program, like I said, gradual and graded exposure and progression to activity, exercise, and stress, so that we build up the tissue tolerance to that stress, and also incorporate proper recovery programs where we have a proper stress and recovery cycle. When there's not enough recovery and we're adding more stress, either it be school, weight training, sports, and we're not recovering enough, then our body starts to go into a deficit, and then that increases our risk of injury. So we want to have a good recovery and stress cycle. All right, so a couple of things. Let's pull up the two camera shot here, and we'll talk about some of these movements. So we talked about the deadlifting, which is our hip hinge archetype, our squat, and some things that we're going to be looking for in that, and also some exercises to work on this posterior chain. All right, so the first hallmark is the ability to hip hinge. So we talked about in other classes about how we have to keep our core engaged, our two-handed rule from sternum to pubic bone, that if we engage the abdominals, my transverse, my deep abdominals, my internal external obliques, and my rectus abdominis, and my back muscles, that if I start to move and squat, that I don't round or extend my back, and my two hands do not come together or come apart. All right, so here's our two-handed rule. And if we apply that to our hip hinge movement, where this part stays as still as possible so that this distance doesn't change, I send my hips back and I get into a deep hip bend where I'm creasing at the hip. My weight is going backwards onto the heel, and my shin is vertical. My shins don't go forward. So this movement here, whether it be picking a weight up, some type of exercise like this, or being in an athletic posture, a hip hinge is integral, and this engages that posterior chain. It's integral with a lot of these sport activities. So we want to be able to master that movement. The other movement that we want to master is a squat, and it's a very knee-dominant motion. So a couple tips for that is that our feet are slightly wider, and we want to keep the feet flat with our squat. And it's going to be a knee-dominated movement, meaning that the knees will move more, but we still have the hip motion that goes down and back. But as I bend my knees more, that drops the hips into this position. So essentially, I need to be able to attain a hip lower than knee posture, and that requires full knee flexion, range of motion, full hip range of motion, and also full ankle range of motion. A lot of times people will have an issue with getting into this position with a good solid spine because of ankle mobility issues. Now, one quick little check that you can do is that if you get like a heel raise or something to raise your heels, and you started with that and then went into your squat movement, hips going down and back, starting to bend your knees, two-handed rule engaged, you should be able to get down a little bit lower if you have ankle issues. Now with my heels elevated here, there's not much stress on my ankle. The range of motion there is not as much as if I squatted with my feet flat. So that tells us that the range of motion of the ankle might be suboptimal, and we need to work on that. Another exercise that we might discuss is about posterior chain strengthening, and that's anything that kind of engages this posterior chain in terms of from the heel all the way to the base of your head. So exercises like we talked about before, the deadlift where we're picking something up in this fashion using that hip hinge archetype motion. We can go single-legged like an RDL with a kickstand, or RDL, Romanian deadlift, with a single leg with the leg going backwards to help balance our weight of the trunk going forward. So that all works on our posterior chain. Now from the upper extremity, anything that's pulling will also work on that posterior chain. So if I kind of did a hip hinge and did a bent over row, some type of variety like that, I can engage my posterior chain of the back and the shoulder blades, and I can kind of add that into all the other movements that we just did. If I'm going to do the single-legged RDL, I can reach down, do a little bit of a row, and then come back up, and then repeat with the other leg. So now we're incorporating balance, posterior chain, strengthening, and stability as we're combining a lot of these movements together. So we're integrating instead of isolating. So those are just a couple options. Again, you could probably look at the Better Spaces apps or whatever to kind of look at the other classes that are available that we go over a whole bunch of other stuff like that. All right, I'm going to check the chat, see if we have any questions. Here we are. Excellent. Thank you. All right. So that's all for today. I thank you for coming and spending your Tuesday afternoon here. I'll be back on Tuesday, September 9th for late summer running reset. We're going to talk about strength and recovery for the fall race season. So many runners prepare for the fall 5Ks, half marathon, or cross-country season. The next session, we're going to talk about helping runners build durability and improve performance as mileages start to increase heading into September. So the things that you're going to learn next time is key mobility drills to support higher mileage, the most overlooked strength exercise to prevent shin splints, IT band pain, and plantar fasciitis, how to structure your week for injury-free progression, foam rolling and recovery tools that runners should be using, and how to address nagging pain before it becomes serious. So any questions, feel free to email me here at paul@par5pt.com or team@betterspaces.com. Again, thank you for coming and be well.